Across the country, pharmacy students everywhere struggle presenting their daily patients. These few brave preceptors have taken time out of their day to provide sage advice. Cut.
I think one of the biggest problems I see when the students present their patients to me is that they will present just the information as it was told to them on rounds or as they read in the chart without really any assessment, particularly on the pharmacotherapy.
Number one, not knowing your patient well enough. So you should know your patient backwards and forwards. You should know everything about your patient, all the information that you have access to, but that doesn't mean you're going to present that information when you present your patient cases. But you should still know it. So for example, if your patient is on vitamin D supplementation and they've had vitamin D levels in the past, you might not necessarily present that when you are discussing their diabetes, but then I might ask you for that information, so you should still know it. Number two is being disorganized in your presentation. So you may have a patient that has several problems that you are discussing. So your patient may have diabetes, hyperlipidemia, and hypertension. So when you're presenting your patient and you're going to talk about all of those problems, you need to just begin with one of the problems. So let's say you present diabetes first, so you should start with the HPI for diabetes and work your way all the way to the plan, and then move to hypertension, start with HPI, move all the way to the plan for hypertension, and then do the same for hyperlipidemia. It's much more organized that way instead of jumping back and forth and giving information on blood pressure when you're talking about diabetes or vice versa. And the third is being too wordy or not being concise enough. So I don't need to know every value of a hepatic panel if everything was normal. I don't need to know everything that the patient ate for breakfast or what they had for supper last night. All I need to know is their diet healthy? Is it unhealthy? Are they getting too many carbs, too many sugars, too many fats?
Dr. Bowers, what is the biggest problem you see when students present their daily patient cases?
I think our earliest students have a huge problem of data dumping. They give me a bunch of lab values, a bunch of numbers, but never actually assess any of those or apply it to the actual therapeutic plan.
I think the biggest problem that students initially have with presenting a patient is they don't know how to kind of narrow down what's important. So they'll take this patient and they'll go through their history and all of that is important. But then what they'll do is once they get to the labs and vitals, they'll just start pulling every single lab value that they have. And they're not really digesting it as far as is this lab important based on the medications they're taking or based on the patient's disease state. So I think that's probably the biggest thing.
At first, it's that we get so much information from our students and we're getting all the labs and all this information. And then once they learn to streamline and present the most pertinent points, the other thing, and this is more of a end of the first month of internal medicine, beginning of the second month skill, is to really, really understand what's going on with the patient's medications.
Students need to know. What was the question? The real question again? Now I can't remember.
Are you ready? Action.
Organization is key, and I think it's very individual for the particular student. While there can be lots of tips for how to be organized for the student to figure out what their organizational system works best for them, a particular form or highlighters or colored pens, something that helps them stay organized and keeping up with their patient information on a daily basis.
So my biggest advice to students going on to rotation is to be very organized when you look at patients and to develop a organized template when you work up each patient so you can stay consistent. So go through HPI, go through labs, go through current medications and so on. And then to take the HPI problems and match up their current medications so that you can really assess what they're on and what they should be on.
My best advice for students who are first starting out on rotations is to really focus on the process. Find something that works for you, which may not work for your neighbor who's also on rotation with you, that allows you to not only gather the information but actually assess it.
Well, some advice I might give to students as they're just starting to work up their patients and they're just starting to develop their clinical process. They may want to start to catalog the patients that they are working up and presenting in terms of their disease states, because you never know when you're going to want to go back through your patients and select one for a case presentation or some other sort of presentation in the future.
I think that the best advice for working up and presenting patients for our students is this is the only time in your career that you are going to have this much time to look at a patient. For us in practice, we may only have 5 or 10 minutes to look at a patient, or we may just be running upstairs with our laptop and working up a patient while the patient's being presented on rounds. So just to be aware that you have this time, go ahead and take this time, because your patient load is going to be lower than the average hospital pharmacist patient load. And so understanding that it may take you 30 to 45 minutes to fully work up one patient. And so being patient and taking that time to do that, and then also if your preceptor hasn't shown you the process that they go through, usually we'll show you that in orientation, or if you need to see it again, just not being afraid to ask, can you show me how you work up a patient? What are some of the steps that you go through? Especially if you're learning a new computer system, it may be very helpful to have somebody walk you through some tips and tricks.
So what I usually have my students do is when they start working up a patient, to start with the H&P. So you go to that H&P document, that history and physical, and that really is the most important document as far as why the patient is here. So you find out why the patient is here, you find out information about them, and then you're able to, once you know what's going on with the patient, then you're able to dig and find out what labs do I need, what tests do I need, and start putting it all together. Then I would recommend that when you're presenting it to your preceptor, to go on a kind of disease state by disease state order, with the most important problem first, and then how what the team is doing to assess that, and then what pharmacy related problems you have identified.
So depending on the nature of your rotation, patient case presentations are typically broken down into one of two ways. The first way, if you're in an intensive care unit or maybe a general medicine unit, is you might present based on organ system. What does that look like? That looks like starting the presentation with a brief introduction of the patient, their chief complaint, what brought them here, maybe their home medications, and pertinent past medical history, surgical history, and maybe in some cases social history. And then going into kind of just a holistic overview. When I was a student, I was in a neurocritical care ICU, and I actually made a sheet to help me kind of think of some important things throughout the course of my patient workup. So in this specific sheet, I have the day of the week, and I start at the top with neuro, and then I go to respiratory, and then I go to cardiac, again working from north to south down the patient's body, renal and electrolytes, endocrine, hematology, musculoskeletal, and then infectious disease, along with prophylactics. And then at the end, what I like to do is kind of bring everything full circle with a problem list. And I ask my students, and your preceptor will likely ask this of you, is to tier the patient you're following, their problems, presenting the first one that's most severe, most acute in nature, kind of going all the way down the list to what you feel is the least acute at the current moment. The other kind of method that you can present a patient, like you might find in my rotation, for example, so we are a cardiology service, so of course going through the entirety of the patient, we focus on the heart, of course, but that doesn't mean I want you to miss out on all the other important facets of the patient's pharmacotherapy. And so my approach to patients, patient workup for you all, will typically be presenting the general information, if it's a new patient to us, what brought them in, their past medical history, past medications, and then what we've done for the patient, kind of a narrative, if you will. They've come in, we've started a diuretic on them, we've added back their home beta blocker and ACE inhibitor, their blood pressure is controlled, they're diuresing this amount, and then I ask you to go into their most recent labs, the 24-hour events, if you will. And as we get from a broader sense of what brought them in, and we narrow down into, okay, what are we most worried about today that we need to bring up during interdisciplinary rounds? And then at the end, I'll ask you to come up with a problem list. Again, what do you feel is most acute? What do we need to address first with this patient's clinical care, their course of care, down to the least pertinent, but things we still need to keep in mind. This is going to be challenging. We're trained to look at everything, every triglyceride level, every blood glucose. The challenge for you all this year is to start to prioritize your time, and that's what you're going to have to do as a practicing pharmacist. You might have 25, 30 patients on your list to caring for them that day, and as much as we'd like to add everything, all the details, it's just not feasible in the course of the day. And so you're going to have to really focus your attention on what is most pertinent for that patient for that given day. And this will come with experience. So one of the take-home points that I'd like to emphasize is to not get frustrated. It's easy to get frustrated and say, I have all this information, how do I synthesize it? Focus on information in little bits and pieces, and again, try to tier them based on what you feel is the most acute need at the given time. After that, and again, that will be born out of experience, I think I wanted to alert you to some of the common pitfalls that I see, particularly students early on in the year kind of falling into. And that is, again, I've already referenced one of them, which is trying to include just too much information for the patient presentation. So again, focusing on what exactly is pertinent for the patient at this given time. It might have been pertinent a week ago that the patient got drug XYZ, but today, 7 days later, it may not be, and so you need to make that decision if that's something that you'll need to include in your workup today or not, if that was pertinent in the patient's kind of clinical course. As you work through your patients and you present your problem lists, or you go through new drug therapies that have been started or continued, I want you to always try to align a drug therapy with monitoring parameters. And so as you progress throughout the year, not only are we going, a goal of yours and a goal of your preceptors will be to narrow your focus or become more streamlined in your focus of what do we really need to know for the patient in this given day at this given time. But it also is important to know how what we're doing today will affect the patient in the days and the weeks to come. And so a goal for yourselves that I would recommend is when for example, we have a patient that comes in, they've just had an acute coronary syndrome. So most likely that's going to be one of their biggest issues. And so we say, okay, the patient comes in, they've had an acute coronary syndrome, let's say they've had an NSTEMI, we started them on dual antiplatelet therapy, that might be aspirin and Plavix, for example. Then I want your mind should immediately trigger, okay, well, how are we going to ensure that therapy is efficacious for the patient? How are we going to ensure that therapy is safe for the patient? So you might say we've instituted dual antiplatelet therapy per NSTEMI guidelines, maybe cite a piece of primary literature or two, depending on what your preceptor kind of likes, and then say, here's how I'm going to monitor that moving forward. I'm going to look at their platelet count. I'm going to make sure their hemoglobin and hematocrit are staying stable. I'm going to ensure that when the patient goes to the bathroom, they're not, we don't have a suspicion for bleed. I'm going to monitor the patient and make sure that there's no bruising that occurs. All the things you would associate with a monitoring plan should be in place when you present a patient and you discuss the patient's therapeutic course. In addition to that, it's always good to think ahead when the patient's discharged. So think about, is this a therapy I anticipate them being on when they go home? If it is, how do I address the social considerations for, will this be covered by their insurance? If not, what's the mitigation strategy? Being proactive and anticipating and trying to react proactively to medication-related issues is the key to a patient's success, and really key to your role as the pharmacist with the team. And so I encourage you all to do that. Again, this all will be born out of experience. Your preceptors will be here to help guide you through. Right now, being the end of April, early May, as you all get started, these are just some early clinical pearls. Again, I want to congratulate you all for making it, and wish you all the best on your clinical rotations in the months to come.
Dr. Bowers, what is the best advice you have for students starting clinical rotations related to working up and presenting patients?
Well, hello there. I am Dr. Bowers. Thank you for asking. Just keep going. Just keep going. That's what I would say for the students should do.
Just keep going.
Just keep going.
When the pimp's in the crib, ma, drop it like it's hot. Drop it like it's hot. Drop it like it's
My best advice for